Welcome to the deep dive. We've got some really fascinating source material today painting this picture of, well, just immense potential for healthcare transformation.
Yeah, it's quite something.
And we're zeroing in on India, a country with this huge, complex healthcare landscape, and it seems like it's right on the edge of a massive digital shift.
It really does. When you think about the scale, over 1 billion people, the geography, cities, remote villages, all the infrastructure challenges that come with that.
Right.
The idea that technology, specifically AI and these digital records we're talking about, could reshape everything, it becomes incredibly clear how impactful it could be.
Absolutely. So our mission here for this deep dive is really to unpack all this material. You've gathered the articles, the research, pull out the crucial bits, and try to get a handle on what this transformation actually means, for making healthcare more accessible, more efficient, maybe more affordable across India. Because it feels like this digital shift isn't just sort of happening on its own. It's being actively pushed, right, by government plans, policies, tech advancements.
That's a key point, yeah. It is being built deliberately. This whole digital future needs a backbone, and that infrastructure build-out is really being led by the government.
Okay.
You can look back at the National Health Stack, which they first talked about in 2018. The basic idea there was to create a standard way for things to connect, an interoperable framework, like digital tracks for health data to run on safely.
Got it. And that sort of evolved into the National Digital Health Mission, aiming for a whole national ecosystem.
Exactly. And the piece that keeps coming up in the sources, the one they call truly foundational, is the Ayushman Bharat Digital Mission.
ABDM.
This isn't just, another program. It's designed to be the essential digital backbone for data exchange, for the infrastructure that everything else needs to connect to. It's really the bedrock.
And it's not just the bedrock. They've also created a space for people to build on top of it. I saw mention of a sandbox.
Yeah, the National Health Stack Sandbox. That's specifically for developers. So they can build and test out applications, including AI tools, within this new framework that's being set up.
Interesting.
What's really insightful, I think, is realizing these aren't just efforts to digitize old paper records. They're intentionally building an ecosystem designed from the start to handle advanced tech, like AI. That really paves the way for applications you couldn't even imagine doing at this scale before.
Okay, so foundation's being laid. Let's talk about the star player here, AI. The potential uses across Indian healthcare seem, huge. Revolutionary, even.
They really are.
The sources are highlighting everything from making diagnostic imaging better, improving patient care, speeding up medical research, rehab, even streamlining all that background admin work.
And this is where AI isn't just a nice-to-have feature. It feels like a direct response to some of India's biggest healthcare challenges.
How so?
Well, you've got limited access to doctors, especially specialists, right? And most facilities are in cities. AI offers ways to scale up, to basically boost capacity where the human resources are just stretched too thin. It could potentially bridge those geographical divides, improve access for millions.
Okay, this is where it gets really interesting for me. The specific examples, not just theory, but where AI is actually being used in clinical practice now.
Right, and we are seeing some compelling examples already. AI systems for detecting diseases are proving effective. Telemedicine platforms are definitely expanding. Even public health surveillance is starting to use AI for better tracking and insights.
The sources pointed to specific successes, like in TB screening, breast cancer detection too, I think, and eye care.
Yes, ophthalmology. And there's significant work happening, like NIDI and the Department of Biotechnology are building these large, specific cancer databases, which are absolutely crucial, for training AI models that actually work well for the types of cancers prevalent in India.
That makes sense. You need relevant data.
And a really impactful example that was cited is Wadhwani AI's solution for TB patients. It uses AI to predict the risk of patients basically stopping their treatment early, or worse, their mortality risk.
Wow.
That's a huge challenge in managing TB in India. So having that kind of predictive power aimed right at a major public health issue, it really shows the practical value beyond just, say, diagnosis.
Yeah, that's very specific.
Diagnostic imaging, too, is a potential game changer. AI can help make up for the shortage of trained radiologists, especially outside the big cities.
Okay, so diagnosis is one big area, but what about managing ongoing conditions? Chronic diseases seem like another area with huge potential, right? Things like diabetes, heart disease.
Absolutely. Hypertension, too. These are a massive health burden everywhere, including India.
And AI can help there. How?
Well, AI-powered monitoring systems, virtual health agents, they're starting to change how these conditions are tracked and managed day to day. For diabetes specifically, the sources talk about things like automated insulin delivery systems, sophisticated tools to help doctors make clinical decisions, AI-driven coaching for diet and lifestyle, and these integrated telemedicine platforms.
And what does that actually do for the patient? What's the real benefit?
It can lead to much better glycemic control, potentially cutting down on long-term complications, and it allows for really personalized treatment plans, giving patients insights they can act on. It shifts things from just seeing the doctor occasionally to more continuous, tailored management.
So it's not just detecting things faster, it's fundamentally changing that ongoing relationship between the patient, their health data, their care plan.
Precisely. And AI-powered telehealth platforms are key to this. They make remote monitoring possible, consultations via video calls, apps, even AI chatbots. This cuts down massively on the need for patients, especially rural ones, to travel long distances just for routine follow-ups.
It was pretty compelling that some studies mentioned showed that outcomes with telemedicine can be just as good as in-person care.
Yeah.
And that telemedicine education for diabetes patients actually improved things like adherence and HbA1c levels.
Exactly. And AI is really the engine making a lot of that remote support possible and scalable.
Okay, so if AI is changing clinical work, what about all the paperwork? The admin side of healthcare must be huge.
It is. That's a critical point the sources dive into. Doctors, nurses, they spend a massive chunk of their time on documentation, time not spent with patients.
Right.
AI offers some powerful tools here, things like AI voice-to-text software. That's already making a difference. Real-time transcription of notes, it boosts efficiency, improves accuracy.
And then there's generative AI, GenAI, that seems to be seen as like the next level.
Yeah, potentially revolutionary. The sources highlight how it could automatically generate complex things like discharge summaries. And critically, maybe even do it in the patient's own language.
That would be huge.
Absolutely. Plus, providing real-time summaries of clinical notes during a consultation. Think about the impact. Patients understand things better. Clinicians get time back from manual charting. Admin effort gets optimized.
It seems AI can also help with just the basic logistics, like appointment scheduling, predicting how long things take, managing repetitive tasks.
Exactly. Automating those workflows that just bog staff down. GenAI's ability to create content, not just automate tasks, means these systems aren't just faster, they can be much more sophisticated, scalable, potentially changing the whole patient journey.
How so?
Well, it enables truly personalized medicine by synthesizing huge amounts of data. It offers really advanced clinical decision support for doctors. And think about GenAI virtual chatbots. They could offer 247 interaction, instant personalized answers, tailored health advice, customized patient education.
The sources even mentioned this concept, AI-powered rapid,
Yeah.
as a potential paradigm shift.
Yeah, rapid, focusing on rapid adaptation, continuous innovation, delivering personalized, efficient care. It sort of paints a picture of AI not just as a tool, but maybe like a new operating system for how healthcare develops and gets delivered.
It sounds incredibly promising. I mean, tackling access, staffing, efficiency, all at scale.
It does. But, like any massive change, actually putting digital health and AI into practice in a country as diverse and complex as India, well, it comes with some pretty significant hurdles.
Okay, let's dig into those obstacles. What are the really India-specific challenges that the sources highlight?
Well, first off, the sheer linguistic diversity. It's huge. Any system has to have multilingual support to be truly useful across the country.
Right, makes sense.
And then there's the practical reality of connectivity. Systems need to be designed to work well, even in low-bandwidth environments. That's still common, especially in rural areas.
Affordability must be another big one.
Definitely. These technologies can't just be for the big, fancy hospital chains. They need to be cost-effective for smaller clinics, individual doctors, too.
Yeah.
And you can't ignore digital literacy. It varies a lot among patients and some healthcare providers. So the systems need to be really intuitive, simple to use. And finally, they absolutely have to integrate smoothly with those government initiatives we talked about, like ABDM. That's essential to be part of the national ecosystem.
So those are sort of technical, logistical challenges. What about cultural ones? Did the sources mention those?
Yes, and this is really crucial, I think. While you gain efficiency, there's a real concern about losing the human touch, that dialogue, that personal connection that many patients really value.
I can see that.
Automated systems might potentially reduce how engaged a patient feels or even impact trust, especially when there's often a strong cultural preference for seeing a doctor in person.
And what about the healthcare professionals? Any concerns mentioned there?
There are definitely some worries about jobs. Will AI take over tasks that people currently do? Plus, the upfront cost and just the need for solid infrastructure, reliable power, internet to even run these AI systems, that's still a major barrier, particularly outside urban centers.
So actually realizing all this potential isn't just about getting the tech right, it's navigating this whole complex web practical, cultural, financial stuff.
Exactly.
Which brings us squarely to, well, governance and regulation. How do you manage all this? What's the current situation for governing AI in healthcare in India?
The sources suggest it's very much an evolving picture. Right now, there aren't specific laws only for AI in healthcare, but existing laws and some newer frameworks are starting to provide a foundation.
Okay, so what existing laws apply here?
Well, the medical device rules from 2017 are key, especially the 2020 amendment. That brought software intended for medical use under the rules, which could definitely cover AI algorithms used for diagnosis or treatment planning.
Right.
Then you've got the broader IT Act from 2000 and the SBDI rules from 2011, which cover general data protection and privacy. And, very importantly, the new Digital Personal Data Protection Act, the DPDP Act of 2023. That significantly boosts data privacy rules across the board, which is critical when you're dealing with sensitive health data.
And any guidance specifically aimed at AI in this context?
The Indian Council of Medical Research, ICMR, has put out ethical guidelines for AI in biomedical research and healthcare. They focus on patient-centric principles and explicitly say we need more nuanced governance as AI use grows.
What about the bigger picture, the national AI strategy?
Yeah, the National Strategy for AI and various papers from Niti Aayog, like Towards Responsible AI for All, they lay out these high-level policy ideas: responsible development, deployment, focusing on privacy, security, accountability. The government clearly sees AI as important.
And there's an AI Safety Institute coming too.
Yes, the India AI Safety Institute, planned for 2025. That's another big step, aiming to ensure AI development is ethical and safe, specifically within the Indian context, and boost domestic R&D.
So it sounds like there's a framework emerging, but maybe the really specific, detailed rules for AI and healthcare are still being worked out.
That seems to be the feeling, yeah. I mean, governing AI is tricky everywhere. It's still early days globally. India has these foundational pieces, but the sources are definitely calling for more detailed, context-specific governance and regular reviews to see what the actual impact is, short, medium, long term, tailored for India to manage the ethical issues and risks proactively.
Speaking of risks, that leads right into the big regulatory and legal hurdles people see. The sources mention a PwC India survey.
Yes, the 2020 survey is interesting. They asked healthcare players about the challenges. Two big risks really stood out. First, compliance risk.
Meaning
the worry that AI systems might accidentally violate existing laws, patient privacy, data security rules about clinical decision-making. 53% called that a major challenge.
Okay, over half. And the second risk?
Control risk. Basically worries about detecting rogue AI systems, unintended consequences, or just not having enough human oversight. Half the respondents, 50%, saw that as a major challenge.
Which underlines that point about human oversight again.
Absolutely. It's repeated constantly in the sources. Human oversight is essential when AI is used in healthcare decisions. It cannot be fully automated decision-making in critical paths.
So AI is a tool, an assistant, but the human clinician stays firmly in charge.
Precisely. The sources stress that doctors, nurses, they need to understand the AI tool. What does it do? When should I use it? What data does it need? And critically, what are its limits? Where might it go wrong?
And transparency with the patient is key, too.
Non-negotiable. You have to be clear that AI is part of the process and get their informed consent before feeding their personal health information into the system.
Data privacy just keeps coming up again and again as a huge concern.
It's absolutely central. You need really strong data protection, specifically for health data. It's incredibly sensitive. Digitalization enables AI, sure, but the frameworks must enforce strict confidentiality and security.
And we mentioned the general laws like the IT Act, SPDI rules, and the new DPDP Act.
Right, those provide the baseline. There have also been proposals for health-specific data laws, like DISHA, the Digital Information Security and Healthcare Act, and the Health Data Management Policy from 2022.
But concerns remain.
Yes, concerns about data security and privacy definitely persist. And new vulnerabilities pop up, like with GenAI, you hear about prompt injection, people trying to trick the AI. The sources consistently say addressing privacy, security, making systems interoperable, ensuring reliability that's fundamental for building and keeping patient trust as these AI systems roll out.
Okay, so given all these challenges and the evolving rules, what actual strategies or frameworks for governing AI and healthcare in India are being suggested in the sources?
Well, one framework looks at prioritizing governance based on market failures and where public versus commercial interests lie.
How does that work?
For areas with high interest and potential information gaps like complex medical imaging AI or drug discovery tools where the user or patient might not fully understand the tech, governance should focus on transparency and accountability, making it clear how the AI works, who's responsible if it messes up.
And learning from what other countries are doing.
Yes, looking internationally. The EU AI Act, for example, takes a centralized, risk-based approach. High-risk AI gets stricter rules, transparency, human oversight, audits. The U.S. is more fragmented, sectoral. The idea is India could adapt elements, maybe like that risk-based approach, tailoring rules to the potential harm, but really focusing on transparency and accountability for high-risk clinical uses.
And there was a second framework mentioned, too.
Right, a task-based analysis.
Yeah.
Instead of looking at AI broadly, this zooms in on specific healthcare tasks. A doctor reading an X-ray, a nurse updating charts, a patient managing diabetes. How does AI impact that specific task now, in the medium term, in the long term?
And what does that tell you?
It helps pinpoint really concrete needs for making AI work in India. Like, we need better data sets, specifically from India. We need clear accountability for this type of AI use. We need to upskill medical staff to work with these tools effectively. It makes the governance challenges more tangible.
It really keeps coming back to tailoring everything, the AI itself, the rules around it, specifically for India's unique situation.
Absolutely. The sources hammer this home. Governance needs to consider several key things for India. We need regulatory standards for AI trained on Indian data, ensuring quality, making sure it actually works for the Indian population, and making it explainable so doctors trust it.
And the deployment model again.
Yes, the recommended model, strongly reinforced, is AI accelerated, but with a human firmly in the loop. GenAI, particularly, seems to function best as a co-pilot, not the pilot. Human judgment remains key.
That human oversight point is just central, isn't it?
It seems to be the consensus, yeah. For things like drug discovery, the government can help by setting clear standards. Maybe streamlining approvals for AI-driven research, potentially amending clinical trial rules. Regulatory clarity is just vital, so hospitals and clinics know how to integrate these tools safely.
And using existing structures.
Right. Adopting AI into existing national health missions for admin tasks or helping patients stick to treatment plans. Leveraging policies like the National Health Data Management Policy to provide the data governance framework, ensuring privacy and compliance. Fundamentally, success depends on getting those India-specific data sets and standards right, especially for AI that interacts directly with patients, like chatbots.
And all those implementation needs we discussed earlier.
Exactly. Multilingual support, working on low bandwidth, being affordable, usable by people with varying digital literacy, integrating with ABDM, nailing data privacy and security. All of those practical needs have to be baked into the governance approach itself. They're not separate issues.
So building this future isn't just about inventing cool tech. It's about nurturing responsible development within this very carefully designed collaborative framework.
Which means exploring things like sectoral regulatory sandboxes for AI in healthcare in India. Let people experiment safely before rolling things out widely. And critically, it needs deep collaboration. The tech people, the doctors and nurses using it, the policymakers setting the rules, they all need to be talking constantly.
And probably starting small, phased rollout.
Yes, phased implementation, starting with pilots, learning, then scaling up. That's strongly recommended.
It really sounds like whether this succeeds depends on so much more than just whether the AI algorithm works in a lab.
Oh, absolutely. The sources really underscore this. Success hinges on real-world stuff. Is there enough good quality data? Is the infrastructure reliable? Will doctors and patients actually use it? Does the cost-benefit analysis make sense for India? And can healthcare organizations manage the change effectively? It's a complex, ongoing process. Requires continuous effort, adaptation.
Looking at the overall picture from these sources, though, Despite all those challenges, the feeling is definitely one of, well, profound optimism, real innovation happening.
It is. The clear ambition is to make healthcare in India much more centered on the individual, more personalized, more accessible across the board, and way more efficient.
And the potential wins are pretty compelling when you list them out.
Better diagnostic accuracy, especially where resources are scarce now. Getting timely, accurate care to people in remote areas. Streamlining all that admin work to free up clinicians. Giving doctors powerful insights they can actually use. Ultimately, shaping a healthcare environment that's more collaborative and truly patient-centered.
So the governance challenge, when you boil it down, is about building up that regulatory capacity and picking the right tools, the right policies to make this amazing vision happen safely and fairly.
It's a huge balancing act, isn't it? You have to protect the public interests, safety, privacy, security, equity, but you don't want to stifle the incredible innovation AI offers, especially for meeting India's specific massive healthcare needs.
We've certainly taken a deep dive today into both the huge potential of AI and digital records for India's healthcare, and also the very significant, often uniquely Indian challenges that have to be navigated very carefully.
Yes.
It's clear that actually realizing this potential isn't guaranteed. It's going to take this really thoughtful, comprehensive, and specifically Indian approach to the rules, the governance, the collaboration, and it has to keep evolving as the tech evolves. It's definitely an ongoing journey, fascinating to watch.
Indeed it is.
So as we wrap up this deep dive, maybe here's a final thought for you, the listener, to consider. We've talked a lot about AI empowering healthcare systems, but perhaps the real measure of success for this transformation won't just be the cleverness of the tech itself, but whether it genuinely empowers both the patients and the providers on the ground. Does it build trust? Does it ensure fairness across India's incredibly vast and diverse population? What does truly empowered healthcare actually look like for everyone in India? Something to mull over.